Okay, my name is Dr. Randy Lee, and I'm a general dentist in Milpitas.
What does a typical day look like for you?
It can vary. Here, I'm pretty much by myself, and I just see one patient at a time. And so it could be anywhere from doing general dental cleanings, examinations, x-rays, and then cleaning the teeth, to doing some small fillings, to doing, it could be involve extractions or some simple root canals, or even restorative work like crowns and bridges or removable appliances, dentures. So it kind of varies among the day what it's made up of. When I was started college or very young, then I was interested in actually medicine. Going to college, then I started to realize that I wasn't as committed toward medicine because of the course load and the amount of schooling that you would need. So I started looking to other health professions, and then I kind of had narrowed down at a certain point to dentistry or optometry actually. And then I went to listen to various dentists talk about their career and what they did. And I remember one of them saying, if you're not quite sure what you want to do, sometimes you have to think about what kind of lifestyle or what kind of life that you want to have. And so then when you look at dentistry, how we describe dentistry is like, it's you have your own business, you pretty much work 8 to 5, even though people may not like to come see you, you're still respected in the community. And then you're working with your hands, that type of thing. So I thought, okay, that sounded pretty good. And then I ended up, for me in my case, I ended up actually, truthfully, I took the dental admissions test. Is a test that you have to take before you to apply to dental school, and then I did well on that. So I figured, oh, okay, sometimes I've come to believe in fate and destiny. So when the stars kind of line up for you to go in a certain path, then it's kind of a sign that, oh, you're heading in the right direction. So I think that's what took me here. In terms of like choosing dentistry, than what I described earlier, then once you go through dental school, then I decided that there wasn't any particular area in dentistry that I was drawn towards, so I decided to stay with general dentistry. I did a year residency. For dentistry, it's not required to do a residency. Once you graduate, you take the licensing exam, and then once you pass that, then you're free to go out and practice. I decided to do one more year of general dentistry residency, and then after that, then I started to look for a job. So I did the residency in San Francisco. So there was someone that was looking for a dentist in San Jose. So then I was able to get that position, and then it just stayed in the area since then. And then I was an associate probably for about 7 years. So back in the day, that time, most people, when they graduate dental school or finish their residency, then they'll work a year or two maybe for someone as an associate, and then they'll start to get their own practice. But for me, I took 7 years because I wasn't quite sure, in terms of looking for practice of one that I liked or thought was appropriate. After my associateship, then I rented space actually out of this office. The dentist that was here worked Monday through Thursday, so then I ended up using the office from Friday and Saturday, and then I would just see my friends and my family to start. And then gradually I got busier, and then the dentist that was here needed help with someone to help them with their cleanings, do their cleanings for them. So I helped him do that one day a week, and then eventually he wanted to sell the practice. So then since I had been here, I was comfortable. So then I bought the practice from him, and then been here since. Yeah. I probably like a lot of things is a certain amount of critical thinking. Obviously, for general dentistry, you're working with your hands but also the critical thinking because you're problem solving every day. Someone has a problem, you're trying to think of how to fix that. Every tooth, every person's mouth is individual, so it's not like I can, you have an iPhone and this has a camera and I just buy another camera and stick it in there. No, each person, the part for each person is customized. And that requires a certain knowledge base of for science, obviously. For when you own your own practice, then you actually wear a lot of different hats. And so there's a business side of it, there's the marketing side, there's human resources dealing with the staff and the patients, there's, even repairing your own equipment and stuff like that. So it's not just the general dentistry, but also the business side of it. And so that's the thing about someone owning their own business, whether it be dentistry or dry cleaning even, you wear a lot of different hats. And so for some people, they want that, they like that. For other people, they don't want to be a business owner. They would rather work for someone and then they take care of other things, So, but in terms of having your own practice or your own business is something that you're creating. That's part of what you do or yourself. But not all dentists will be in a private practice. Sometimes some dentists will be in a larger clinic, in which case they can be an employee, or you might work in a hospital or some other large or health center. Some people are in academics or in research. So there's a lot of different ways that someone with a dental training can work. It's just for here, it's just most common is private practice, but there are other places or others venues that someone that's trained in dentistry can work. Generally, here you have to apply to dental school, an accredited dental school. To get into dental school, most will have a bachelor's degree, and then you usually will need to take an admissions test, and so that's a standardized test. And then with that, then you have obviously your other extracurricular things, whether it be leadership positions or positions that kind of show that you have an interest or understanding of what dentistry is, and then they go through a selection process. And then most dental schools are 4 years. There's only one in the nation that's at University of the Pacific in San Francisco. That's a 3-year program. Once you graduate from dental school, then you have to take another exam, a board exam that will certify that you're able to do dentistry. And then they're different depending upon what part of the United States you want to work in. Then they have different regions, regional boards exams that one may take. So for example, I'm licensed here in California, but if I wanted to practice, say, in Florida or New York, then I have to take another licensing exam. After the 4 years of dental school, then there's you can either do a year of residency that sometimes could be hospital-based, or it could be a clinic-based, and then that's where people generally will have more practice in doing maybe more advanced cases with some supervision. Some people will want to specialize, for example, in orthodontics, oral surgery, or endodontics, which is root canals. Then that could require another 2 or 3 years of training. And then once you do that, then there might be another examination for certification purposes, and then you can come out and practice. So in general, I would say that probably all experiences in high school is important. Whether you volunteer and you work with different people to kind of gain that experience with empathy, general knowledge, and be able to relate to people. That's probably all that is important, I would think. I would say, you talk to as many people as possible. I think that a young person well, especially if you're in high school, your exposure to life in the world is somewhat limited because you're limited by the short life, relatively speaking. You know, maybe if you're 17 or 18-year-old, you might think that that's a long time, but actually it's a very short amount of time, and your world is kind of limited to your family, your friends, or the small community that you're in. But in a sense, there's a whole world out there. Right? But now there's the internet, and you have a lot greater exposure. But I think my advice to a person is kind of like, well, when I think of people when you go off to go to school, or like if you're in university, whatever university it may be, I try to tell people, young people, to treat it like when you're little and you're going to a toy store. You might be going to the toy store thinking that, oh, I'm gonna go and buy a skateboard. But when you go to the toy store, do you just go straight in, get the skateboard and walk out? But most likely, if you're a little kid, you're gonna go in there and you're gonna look around and you're gonna start playing with all these things. And so that's what I think that a person going off to college, that's how they should treat college. They should treat it like it's a toy store. You should really explore and go and play with as many different things or as possible. Try it. I kind of think of trying to pick a career or a career path. It's kind of like, let's say you saw someone's shoes and you go, where did you get those shoes? Oh, I got it at this shoe store. So you go to the shoe store, and then you look at the shoes and you go, wow, there's a lot of shoes here. And how do you know which shoe is right for you? You got to try them on. So sometimes I think you got to go and play with things, try it, and then maybe you'll start to see that what you were going in for may not be really suit you as much as something else. So I guess maybe your original question, what advice can be, is like, don't necessarily lock yourself into anything in particular, but rather explore and give yourself a chance to see what you may be interested in, what you may be good at, what your passion is. It's when you're young, it's kind of, I think it's difficult to identify that, even though when you apply for colleges nowadays, they ask you to identify what your passion is. But at 17 or 18-year-old, do you really know? I mean, I think that in my day, I remember a classmate of mine in high school, he was scared because he was going, I have to make a decision that's going to affect me for the rest of my life. And he was kind of so scared of it, he was somewhat paralyzed and couldn't make that decision. But in retrospect, you look at it, it's like, how can someone that young make a decision like that? But the reality too is you're never locked in. You can, and that's why if you talk to colleges, it's known that college students will go in and change their majors 3 or 4 times in the course of the time there, because you're exploring, you're starting to get to know yourself, you're getting to an idea to see what the world has to offer, and then you start to figure out how you can fit in. And I think that's why explore and don't lock yourself in so early. That's one of the things I think that someone learns in a 4-year university. One of the things I felt when I went through was it, of course you want to get an A, right? Who doesn't? Everybody wants to get an A. But when you're in college, especially when you're getting, like in my case, I was getting C's, and you think this is terrible. A C is terrible, especially when you're like in high school, if you're in Asian family, C is, you're going to be thrown out of the house practically, right? But C's in college, you have to understand what the grades mean. A is considered exceptional, B is above average, and C is average. So if you're getting a C in college is average, look who you're around. You're around average people, average student, you're rated out. But this population that you're dealing with are the ones that are going to the university. They're in the top of their high school class. So you're not in bad company. So you kind of have to keep that in perspective. So understanding that, and understanding again that in order to reach your potential, you gotta fail. That if you're average in a university among your peers, then that's not necessarily a bad thing. Just because you fail now does not mean that you're going to fail in the future. It's going to teach you about something about yourself. And generally, anything that's worth something is you're willing to keep on trying or keep on trying to improve yourself. So really, it requires a certain amount of, when you fail, you have to ask yourself, how can I improve? What can I do better? And then you try it. And that's how the only time that you truly have lost is when you quit. So that's what kind of learning that through college, and it's like learning, like, okay, it didn't work out the way I wanted it to. What can I do to make it? And the thing too is, you'll talk to people that have gone through their career or their path of their education. There's the short route, which is more direct, like, okay, I'm gonna graduate from high school, I go to college, and then I say I go to medical school, and then I go to my residency and then become a doctor. Some people will go, I graduated from college, then I worked at a health clinic for a little while, and then I became a nurse, and I worked as a nurse for several years. Then I decided, I want to go to medical school, so they end up going to medical school, and then they go off, to become a doctor. So at the end, both of them became doctors. One was more direct and one was a longer route. Now, is the one that's direct better? Not necessarily. The one that had all these other experiences. So when they have a chance to see a patient, they have all these experiences to talk about, to relate to, all the time that they learn to have more empathy, more understanding. So in some ways, they have a lot to bring to the table. Now the person that went direct, they're younger because they got there faster, but they still have more to learn. So understanding these things helps, I think, try to keep someone motivated, because that's the thing is if you look at every college essay that you have to write, the common theme among all of them is going to be, how do you keep on going when you failed? How do you keep from being discouraged? How do you not quit, right? And so, and then some of that is just, it's going to be easy to quit, because if you don't try to, like I said, keep it kind of in perspective, like, you're among who you're competing against, and how do you continue to get better. And again, just because you failed today doesn't mean you're going to fail tomorrow. There's probably lots of things. When probably one that's memorable would be, I was working on a small child, and then they signaled to their fathers, tell the dentist I don't want a shot, the anesthesia. And then he kind of laughed, because I'd given the shot 5 minutes before and they didn't notice. So that was a proud moment, that I was able to do. As a dentist, people don't necessarily like coming to me because of what I do. But when I'm able to do something to make it so that the experience is pleasant or at least tolerable, then that's always a proud moment for me. I think being able to make someone happy because maybe they are embarrassed by something with their teeth or the way they look, and was able to make it better for them. So anytime that you can make someone happy or relieve their pain or fears is a proud moment. probably now is actually sharing with patients. A lot of times you think, oh, doing the filling or doing the crown or doing extraction is nice, but I think being able to share the perspective of life or the different experiences, and being able to learn from them, and then from them to learn from me, is probably actually the most enjoyable part. So that's why I like to talk a lot. It's changing quite a bit. When I first entered dental school, they actually closed a bunch of schools down. Reason being is because they were thinking the number of people applying to dentistry, and was being affected because dental rate of decay in the United States was decreasing. So the amount of fillings that need to be done were less and less. So then they're getting the impression that there would be a need for less dentists. But you fast forward, almost 30 years, and that's different. What ended up happening was dentistry changed to do more advanced procedures and be able to deal with things. So nowadays, at first it was probably, in the early days, it was just the filling material was silver fillings, but then they started to doing more of the white fillings, which were bonded. So that led to a whole bunch of other type of restorations that you could do, more cosmetic dentistry, doing implants. So I think technology-wise, it's actually changing quite a bit. I mean, there are technology where you could take x-rays, and it used to be with the film. Now it's all digital, so it's a lot quicker. That allows for even AI to help analyze the x-ray and then pinpoint problem areas, whether it be a cavity or a cyst or any other type of pathology that may arise, so that maybe give you some clues in an x-ray. There's probably even a certain amount of robotics that will come into play, guided procedures, but yeah, all the technology that's being used, whether it be AI or imaging or 3D imaging, even CAD, some of the restorations used to be done with just wax and pressure material, but now to a certain point, it's almost could be done on the workflow, as they say, could be digital, where it's all, instead of taking an impression to make a model, it's all scanned using pictures and video to create a 3D model on the computer, then restoration designed on the computer, and then it's milled out through a milling machine, and then the restoration is made. So that is quite changing quite a bit. Yeah.